Welcome to Health Systems CIO's interview with Dr. Eric Poon, Chief Health Information Officer with Duke University Health System. I'm Anthony Guerra, founder and editor-in-chief. Dr. Poon, thanks for joining me today.
Anthony, thanks for having me.
All right, great. Looking forward to having a fun chat. You want to start off by telling me a little bit about your organization and your role?
Sure. So I work at Duke Health, which is a large academic medical center led system. We do about 5 billion, actually more than about closer to $6 billion of patient related business a year. Of course, we are also a major academic system with we're also a large recipient of NIH funding, and we are located in the state of North Carolina. We are now 4 hospitals strong. And in my role as the Chief Health Information Officer, I oversee all the clinical systems, analytic systems, and clinical engineering teams here at Duke. So that includes our electronic record um, and all the patient equipment that is used at the bedside.
All right, very good. So the biomedical equipment too.
Mhm.
Okay, very good. All right, so trying to, really tackle the issues around AI that people are dealing with today. And I've been splitting it in my mind into a few different buckets that it seems to be is really at the forefront of the challenges right now. One would be making sure that the organization is tackling the right projects out of all the projects that could be done, and then it would be sort of an implementation type discussion around pilots and things like that, making sure you're doing those correctly or to the best of your ability. And then there's a measurement element to it of deciding,
Mhm.
what did we achieve from what we tried, and should we expand it, or do we need to go back to the drawing board and shelve this one and look at another use case? So let's start at the beginning. This idea of tackling the right projects, having governance structured in the proper way. There's different kinds of opinions as to whether or not AI requires its own governance structure, if it should be sort of just part of regular governance, or if there's some hybrid where it's somewhat separate but then dovetails in at certain points. So I'd like your opinion there on governance and selecting the right projects.
Yeah. So I think governance is a means to an end. And so let me start with selecting the right projects. And our perspective has actually evolved over the last couple years. I would say that uh, today, middle of 2025, the recognition is that AI is not just exciting, it is here. And there are lots of challenges in healthcare that we we believe AI can help us address. And the we is not just us in working in technology. I think our highest level leadership see AI as an opportunity for us to overcome many of the headwinds that we're facing in healthcare today.
Mm-hmm.
And so the corollary of that realization is that AI is not just um, under the purview of either the AI shop or the IT shop. It really needs to be part of the fabric of how we operate day to day and how we think about our overall strategy. So that's observation number one. Um, Observation number two is that because of how big and broad clinical operations is, there needs to be a way to make decisions with the right stakeholders. And
Mm-hmm.
that goes with every discussion regarding traditional IT governance. So every lesson that has been learned over the last few decades on IT governance also applies with AI governance.
Mm-hmm.
And so no matter how organizations manage and articulate the two, that has to be part of the consideration. For us, we have noticed that over the last few years that AI has emerged from more of a niche interest to something that really can change clinical operations in major ways. So the way we are evolving our thinking is that we are thinking about, at least in principle, the three or four things where AI could really change healthcare in fundamental ways. In the context of our health system strategy of putting people first, having a growth strategy, and then providing good patient access while we maintain quality and a good bottom line. And so the way our head is thinking is that we have created a couple area foci for AI. And those, one of them being our inpatient innovation unit, where we are we have converted a number of floors that needed renovation anyway into a place where we can experiment with new ways of taking care of patients, new ways to deploy technology, which many of which will be AI. And so this inpatient innovation unit, it's actually 3 floors,
Mm-hmm.
is one of those areas of foci where we are actually have formal governance to think about what they want to try, what is the, how do they prioritize the things they want to try, making sure that there is a way to not just prove that the technology works, but actually leads to better patient outcomes and has an ROI. So
Mm-hmm.
that is a microcosm of where we are heading. Another area that we are evolving into is revenue cycle. That is not as mature in terms of governance, but we already have a pretty robust governance structure for revenue cycle because of all the ongoing challenges that we are facing in making sure that we are fairly reimbursed and making sure that the complexity revenue cycle is optimized. We are recognizing that AI will play a big role in that. So we now have a foci around that in revenue cycle. But that doesn't mean that that's it. I mean, let's say these are 2 of the major foci for
Mm-hmm.
Duke. There will be AI that needs to be that will come out in different business lines, different areas, and so we are also thinking about how we can stand up a innovation clearinghouse so that we can actually figure out for each of these new use cases. Do we
Interesting.
buy,
Yeah.
build versus partner? So that's where we are heading right now. And maybe I'm getting ahead of my skis, but this is our current thinking now, and that lives within our general IT governance structures. So if and in the context of an internal innovation group that is building something really interesting, this is in the context of a very well-oiled machine for other IT investments we want to make. But I think we are basically finding ways to divide and conquering the whole breadth of business into digestible chunks so that we can engage the right audience to think through how technology can be matched to big areas of transformation. So that's kind of how we're thinking about the right projects.
Mm-hmm.
But one thing that I'm fond of saying, and I keep saying it because sometimes I get a chuckle out of people who are willing to hear, is that when it comes to AI, like technology, you need to kiss a lot of frogs in order to find your prince or princess. And so this is a way of saying that we need to adopt the fail fast mentality, and then we need to have accountability. So yes, we need to pick the right projects, but bear in mind that it's okay that if it doesn't work, as long as we are watching the impact of these projects on the intended outcomes. And this is in some ways where we have evolved our AI governance, because our AI governance in some ways picks up where traditional IT governance leaves off, in that it is actually looking at AI as something that needs to be shepherded throughout its life cycle. So we have in our AI governance, once a decision is made to adopt a particular piece of AI technology, AI governance basically takes over and say, okay, let me help you mature your evaluation plan, make sure that you're ready to deploy after initial pilot, and and when the technology has been deployed, we monitor it so that we make sure that it stays effective and that it continues to yield the value that it promises
Hmm.
to yield. So that is the overall architecture of uh, our AI plus technology governance.
I'm still a little unclear as to whether it's separate in terms of traditional IT governance and AI governance.
Uh-huh.
You said a few things there that you said it lives in the general governance, but then there were a few things you said that made it sound separate, or like at some point it takes over a project once that project is determined to have
Yeah.
AI. So
So I think that's a really good question. The way we evolved it
yeah.
at Duke is that it used to be we started off the two evolved separately.
Mm-hmm.
We had AI governance that was stood up. We were actually one of the first organizations to stand up at AI governance through its own life cycle. Um, that actually had these checkpoints throughout the life cycle of the AI. And then we had IT uh, governance, which was very well established. It
Right.
was a well-oiled machine. What we started recognizing about 3 to 4 years ago is that, gee, um, there's just so many more things are going to have AI, and it's not just going to be uh, a prediction model that our researchers come up with that really needs to be monitored throughout the time. We will see AI solutions coming out of many existing vendors,
Yeah.
coming out of new vendors. We need to have a way to say, okay, no matter which door you walk in within the organization, you need to have a single process. So we have basically said that whether the way we're evolved into is that whether it's AI or more traditional technology, like, oh, I want to change the pulmonary function test vendor, uh, it still walks through the same IT governance process.
Mm-hmm.
But when it's AI, we take the extra care to make sure that once we approve the AI, we help the AI project teams make sure that they're evaluating the technology before in a pilot. And when the pilot is successful and they want to scale it up to others more widely in the in in the organization, they can we make sure that they bring the data forward to make sure that the AI is generating good business outcomes. And then we make sure that those teams come back and every year at least to make sure that the system is used and is bringing value.
So it's great. What is it? This may be a silly question, but what is it about AI that necessitates a different treatment? What is it about this technology that requires some special treatment and attention?
Yeah, I think in the ideal world, everything should undergo that discipline. But I think the stakes with AI are higher because we recognized early on that AI at least was new,
Hmm.
um, and that there are more unknowns with AI. There are more regulatory risks associated with AI, um, and and with more and more AI tools coming out of the woodwork and limited resources, we need to make sure that we prove value.
Hmm.
That's why we have integrated the two and basically have taken the uh, the best of both governance structures and merge them two together. But they perform different functions.
Hmm.
Um, the upfront step is the IT governance, which we have stood up, which asks a lot of questions
Hmm.
regarding what is the business value, Does it pass a sniff test regarding security? And is there potential for this to have to bring value? And can we afford it, at least in the short term? But I think what we have said is that, you know what, with AI, let's make sure that we've put a focus on those projects and make sure that the value actually get realized over time.
Hmm. If you mentioned the idea that I assume almost every vendor out there whose products you're using is looking for ways or has already injected AI into their software or plans to inject AI into their software. And there's an interesting dynamic where taking an upgrade of an application is was sort of, that's been well established how to do upgrades, right? The
Yes.
communication with the vendor. But if a non AI application all of a sudden through an upgrade has now AI in it, I wonder, and I've been talking to people about this, that seems to be an interesting dynamic where they want to be notified because it's going to require extra different treatment. It's going to require a different look than a non AI application would. So, vendor X, I need to know if the upgrade we're going to take has AI in it. And I don't want to find out after the fact. I want to know ahead of time
Mm.
because it's going to get some different treatment. Does that make sense?
Absolutely, Anthony. I think what you're saying completely resonates with us. So what we have done as we've merged the IT governance process with the AI governance is to actually educate folks who are involved in looking at everything that comes through, including new features
Hmm.
that comes with things that with packages like Epic that we can turn on anytime, or things that come through an upgrade.
Hmm.
We are saying that if anything smells or quacks like AI, please reach out to AI governance. You can decide to turn it on um, when through your normal IT governance process. You decide that that is the right thing to turn on, but at least we know
Hmm.
collectively and within the business that there is AI, and our AI governance can actually weigh in on, okay, uh, this seems like perhaps a medium risk uh,
Mm.
piece of technology. This is what we recommend in terms of how you pilot, how you test, and we set the expectation that you really need to make sure that you have a monitoring plan long term.
Yes.
So in some ways, this is kind of like it's our practical way of implementing best practice for
Hmm.
technology anyway.
Mm.
Um, so that's where we are landing. But I think what we're also recognizing is that we can have a single group that weighs all the decisions within a large health system. It doesn't work. So
Mm.
upfront we are biting off the right chunks of people's attention to who are interested in applying technology to solve business problems, to talk about those set of technologies that needs to work together within the area of business like revenue cycle or within the innovation unit to work through those challenges while we still allow other AI to come through. Um, Ambient technology is another example. I think that came through in the context of a lot of clinicians feeling burned out, and we
Hmm.
actually brought that forward but we brought it through our traditional IT governance process, but our AI governance has helped us figure out, okay, what seems like a reasonable uh, pilot plan. What are some of the things that we need to look at during the pilot? What are some of the things that you need to measure? And then our AI governance team has challenged us to think about, okay, what education do we need to provide long term to our clinicians? Um, they have helped us think through, for example, uh, a way to look at systematically whether our physicians are accepting too much of what the AI comes back without editing, and then having the right conversations with clinical leadership to say, you know what, if you're accepting 99% plus of what the AI comes back, that's we are probably trusting it too much. Remember, AI is not perfect. There are nuances in patient interactions with facial expressions that would not be captured by the AI. So you need to look at your notes more carefully. So those are the conversations that we're having
Hmm.
through our AI governance. And then our AI governance saying it's actually we're actually having some active conversations. Should we think about embedding AI education um, more broadly into our our annual training for physicians. So that's something that we're actively talking about. We haven't made a decision yet, but we do know that AI is going to be everywhere. We have come up with guidelines on how clinicians should use generative AI. We've emphasized the importance of professional responsibility, the risk of hallucination, and that they should only use approved tools. But how do we make sure that that message is actually built into everybody's learning life cycle every year? So that's what we're working through right now.
Yeah, and that's one of the ideas we hear about is that AI savvy workforce, developing an AI savvy workforce so that, they're on the front lines, they know the workflows. If they know the potential of these tools, they're going to be able to marry the two, or at least suggest areas where the two can be married. And then you can surface those into the governance process so that great ideas can be sort of, can be fertilized and whatnot. But yeah, I mean, it makes a lot of sense. Everyone talks about having to create an AI savvy workforce. So that education you're talking about,
Mhm.
you can't just assume they all, are going to know about it.
Yeah, and I think that's also something that we are trying to work through because how much do you teach every member of the workforce about AI?
Hmm.
Um, and when are they ready to hear it? I think there are some important general messages that we are working through. For example, um, uh, saying that AI is where we're all heading,
Hmm.
but don't worry about your jobs because clinicians who use AI will replace clinicians who don't.
Hmm.
But what our role as leaders and as part of the health system is to give you the tools to start using the AI in a responsible way. We will make sure that we uh, give everybody the tools to think about how to evolve their roles
Hmm.
as these tools are introduced. And then we invite everyone to help us think through how to imagine the future together. I mean, these are sort of some of the sound
Yeah.
bites that we're working through right now.
Yeah, it makes a lot of sense. Um, you talked about pilots and things like that. You have any thoughts on, are there any unique things or criteria for executing an AI pilot correctly? I mean, we've got all these ideas coming up. Users are going to have ideas, IT is going to have ideas, vendors are certainly going to have ideas for what you can do with it. Selecting the right pilots that line up with the actual problems that you're trying to to work
Mhm.
on, picking the right programs and then piloting them in the right way. You have any thoughts on doing a pilot correctly?
Yeah, we have so many pilots that we have done, and we have learned quite a few things. Um, I think first and foremost, and this almost sounds trite, but it's true, making sure that there is alignment between the problem to be solved and an organization that is ready to allow some kind of intervention to address that problem and technology that is actually that fits into the workflow. That those three things, if aligned well, I think bodes well for a pilot. And these are some of the things that we look for. So part of it is not just assessing the technology, is not only assessing the vendor, but also assessing the current state of the organization in terms of actual real problems on the ground and the readiness for that particular group of staff or clinicians to start using that technology. Um, and and that's a discipline that we continue to hone. I don't think we are perfect by any means, uh, but making sure that those three boxes are checked, I think, makes a lot of. I mean, it's critical. A lot of times we have folks who fall in love with the technology without thinking about the other two pieces, then that's where we have seen um, energies and resources being wasted.
I think that's brilliant, and I'd like to go into that a little more. This
Mm,
concept of uh, the unit or the users who would theoretically be using the tool in question are, I guess if they're asking for it, it's one thing, and that sort of problem, that
mhm,
box has been checked, right? Because they're asking for it. And if they were involved, if they were asking for assistance
mhm,
with something, or they identified a tool as being useful and that was representative of that unit or that group of people, then they're asking for it, right? They're asking for it, so we don't have to worry about that. Isn't it more the case of when it's brought to them and they may say, we didn't want this, we don't like it, and have a good day, we're not using it? But you sound skeptical of my first scenario, so go
yeah, well, so thank you for reading my facial expression. I
ahead.
think in the first scenario, we get a lot of requests for
Yeah.
things, and from our experience, just because somebody is asking doesn't mean that this is the right thing.
Mm-hmm.
So we ask some basic questions that all of us who work in IT have trained ourselves to ask. We ask ourselves, okay, what problem are you trying to solve?
Mm-hmm.
And what does success look like? What, uh, how would this technology be used? And how is it going to solve the problem that you described?
Mm-hmm.
And what what challenges do we anticipate in getting this technology adopted by by the entire group, and how are we going to help them succeed? Now, those
Mm-hmm.
seem like very generic questions, but in just asking
Mm-hmm.
those questions in an open-ended way, we can a lot of times, not all the time, a lot of times tease out um, the scenario where somebody's just fallen in love with a piece of technology because it
Mm-hmm.
looks shiny
Mm-hmm.
at a conference, versus those folks who have really thought through um, the whole end-to-end process and can really see the technology as a lever to transform themselves.
So you're
Is the
saying
p
that,
is the people piece.
yeah, so you're saying that you could still get that wrong, even if the request has come from the users per se. And even for a specific technology, I guess what you're saying is, as an IT leader, you really have to help them understand the implications and the change management. Even though they're asking for it, do they understand that perhaps there could be significant changes in workflow? Um, and you could get into a position where essentially you've given them what they've asked for, and now they don't want it. Is that correct?
Absolutely,
Yeah.
absolutely. So many of us have been in those situations enough times. Those of us who have been around the block, that we want to avoid that, and it does. And the other scenario that we see is that the person doing the asking may not understand the spectrum of workflows and personalities that we expect to adopt this technology. Now, no, we know that one size is not going to fit all,
Hmm.
but if by having these conversations we can help the requester understand whether the technology is just going to work great for a small handful, or it's going to help um, a sizable chunk of the intended users.
Right. So, in order for you to be comfortable sort of with a go forward plan on this, I assume it's not just you, it's a larger governance entity, but you're looking for the tool to address real workflow problems, and you've come to the belief that it's going to cover a wider
Mm.
spectrum of users, and they know what they're in for. They understand the change management that's going to be required, and check, check, check all the boxes. Okay, let's go. So, a lot of boxes have to be checked, and once we get them all checked, let's do this, right?
Yeah, and one thing that I wanted to emphasize, and that's I don't pretend to know everything, and I can't. I actually certainly don't, as one leader, ask all the questions. What we have done is to actually empower the different levels of our technology staff to have to be comfortable being the consultant in
Mm-hmm.
these situations.
Mm-hmm.
So in some ways, part of my role is to be the coach for a lot of my team members to feel comfortable having these conversations with the business. And then a lot of times they welcome it because they really, in talking through the workflows and the change management, they start to think about, okay, they get ready for
Hmm.
what's to come when we do move ahead with the technology. But I didn't answer your question. So you say, okay, so once we pass the sniff test, once the technology passes the sniff test, um, there's still other things we need to do. We need to think about, okay, um, most of these technology costs some money. So even for a pilot, we have to think about, can we afford the pilot?
Hmm.
And if the pilot is successful, do we have a scaling strategy?
Hmm.
Um, we have trained our IT leaders to ask the right questions regarding workflow integration, because if it's, we know that when tools are not well integrated into the workflow of busy users, they're not going to use it. So
Hmm.
this is why IT is actually very well suited to talk through that. We have also trained my IT leaders to ask the basic questions about security,
Mm.
so that when we know that a vendor that isn't mature enough to pass our security evaluations, we actually screen them out ahead of time,
Yeah.
or at least we and then for um, uh, vendors that are promising in terms of its solution, but they may not have met the standards, we help them meet our standards.
Right. Very good. All right. I just want to cover one more area and I'll let you go. You mentioned the term, or the idea of a pilot being successful. I'd like you to talk a little bit about that, the importance of determining with the vendor in question, agreeing to what success would look like, getting on the same page in terms of metrics and measures,
Mm,
having a time frame for when we're going to make a decision of whether or not we're going to expand this pilot or we're going to shut it down. Money is an issue. There's not an endless bucket of money. So for every pilot, I suppose it's good practice to have a finite budget for it and a finite timeline and agreed measures of success. So we look at it on date X, and did we get what we were hoping for? And if we didn't, have a nice day. Or perhaps we could say we didn't, and we think we know why, and we want to give it more time. We want to
mhm.
tweak this, but there's got to be really good reason for that because now you're going over budget and over time. So, what are your thoughts around all this kind of no go measuring and being disciplined?
Well, I think the word is making sure that the organization embraces that discipline. And and I can tell you that we did not develop this discipline overnight. And in some ways, it is still work in progress. I would say that success stories is actually a good way of growing that discipline. So I would point to our success in evaluating ambient technology, um, because I think in that effort we decided to look at two vendors on the market
Mm-hmm.
and did a trial, crossover trial, not just with a small handful of folks, but actually with uh, 160 clinicians. So we actually paid for a short-term pilot for 160 clinicians, half of which use one product and the
Mm-hmm.
other one use the other, and then they switch a month later. And we
Mm-hmm.
decided with a fairly low cost way how to measure baseline satisfaction and burnout. And we asked them after they used product one and after the switch over, they asked them what they thought about product two and which one they preferred. And and because it was actually a sizable pilot, we were able to tease out information as to whether there were subgroups that really strongly preferred one
Mm-hmm.
versus the other, or whether the preference was more
Right.
universal. And so that we're very glad that we did that. But one of the things I did not anticipate in doing that uh, pilot with 160 users is that because as it happened, the technology really worked well.
Mm-hmm.
And of course, these clinicians were not working in a vacuum. Once they realized they were using something that was really helpful, they started telling the clinical leaders
Mm-hmm.
that this is really helpful.
Right.
This is true. This is not just IT saying that this is something that everybody should adopt.
Mm-hmm.
So when it came decision time to roll it out, um, whether we could pay for an enterprise license, I had making the case was actually much easier than I thought at a time when resources were very tight. I think because I had internal champions that were doing my PR without me ever asking them. Um, and that made it easy for us to make the case of the CFO and the clinical leaders. That made it possible for our clinical leaders to say, you know what, we are actually rolling out this technology to alleviate burnout, and we are definitely not going to ask clinicians to see more patients upfront in order to have access to this technology. That was a very important and
Yeah.
fateful decision. Uh, but they also said, but let's look at productivity in the background to see whether there is a signal. So we're actually looking at that now. I will tell you at our next interview if we get to have one what we find. Um, but what I can tell you is that because there was so much buzz with a trial last fall with 160 of our users, when we actually turned it on to every clinician, the adoption uh, was really, the uptake was really good. Actually, our vendor, in this case, Abridge, tells us that Duke Health is leading the way in, we are actually, we're the, amongst the clients, we have adopted Abridge in the most rapid way. So that's telling you something.
Very nice. Well
Yeah,
done. Well
yeah.
done. All
So,
right.
so the buzz is real, and generating buy-in is real, and things that we've always known in IT. But I think what I would say to your listeners and readers is that um, having the discipline does take time and effort,
Hmm.
but that can also pay dividends.
Yeah, that's wonderful. So much learning here, and the things we've been talking about make me think how important flexibility is in terms of because you're learning so quickly about governance and about rollouts and about pilots that we need to capture these things very quickly and make adjustments and integrate learnings, be very iterative in all these things and flexible. Can't be one and done because we may
Mhm.
realize we didn't have it set up the best way. So we need to be flexible. What are your final thoughts on that? And then I'll let you go.
Yeah, I absolutely agree with your summary. I also say I would say that we are all learning as we
Mm.
go in this world of AI. So we absolutely need to share lessons learned. I'm sure that things that we could have done better had we learned from others along the way. So thank you for what you're doing
Well,
in making sure that we all stay at the cutting edge.
well, I'll tell you right before I let you go that what you mentioned about leveraging internal champions to sort of push that ROI discussion over the top is something I heard from someone else yesterday. So where there's a soft ROI, getting those champions, those individual users who may be quite influential in the organization to
Mhm,
express their opinion to those who will ultimately decide about whether it's worth the money is a
mhm,
very effective strategy and
mhm.
embraced by others. So you're on the right track with that one, Dr. Poon. And
Okay,
yeah, I want to thank you so much for your time today. I really enjoyed this, and I hope I can reach out to you down the road and chat again.
anytime.
Have a great day. Thank you.
You too. Take care. Bye bye.
Bye bye.